Thank you for watching this episode of The Bright Bite. On today's episode, I want to talk about something super important. Why do an E&I exam as a dental hygienist? So I'm actually on my lunch break and I've seen about 5 patients today so far. And I found a patient that had a lesion. And I think it's really important that we as dental professionals do an E&I exam on every single patient because it's so important, especially viruses. Like, we all are very aware of how the coronavirus can spread. And more I'm finding patients with HPV lesions in their mouth. They look very verrucous. I'm going to insert some pictures so you guys can see what it looks like. I found couple on the palate of their mouths, and I've also found it like on attached gingiva. It just looks different, and so you have to be very aware of like, hey, this patient has very tightly bound gingiva and this one spot is verrucous looking. It's suspicious. So what I would recommend is sending the patient to have a biopsy done to see what that lesion could be. It could be nothing or it could be something, and this way everybody is happy. I know of a friend whose husband actually has oral cancer from HPV, so it's something that can help prevent later issues with the patient if you find even a small lesion in their mouth. I've also found oral cancer on a patient's tongue, which I'll also insert a picture. And it's very easy as a dental professional to do an E&I exam. It takes about a minute with every patient. So what I do is I palpate their outer face. I make sure to see if all the lymph nodes feel symmetrical and everything feels nice. I also palpate up here and ask the patient, if they notice clenching, grinding, anything like that. Then intraorally, I will actually flip their lip, look this way, and flip their lip up, look up. And then I also have them say, ah, look at the posterior of the throat, especially the palate, roof of the mouth. I have them lift their tongue up and look at the floor of the mouth, even use my mirror to elevate it to see underneath. And it really makes a big difference because patients will be so grateful. Like, oh, what are you doing? I'm actually doing an E&I exam. I'm checking to make sure you don't have any oral cancer. So as a dental professional, most patients actually see you more than their regular doctor. And so if you find anything, even like a swollen lymph node or gland that doesn't seem symmetrical, you could save a patient's life. Thyroids, and you can really help a patient and making sure that they get the best treatment for their overall health, because really the mouth is the gateway to the rest of your body. And I think that it's so important, and our patients really, really like that because you care about them. You're making sure that they are okay and safe, and I think that it's really important. So I hope that you like this episode, and I hope that all of you are doing E&I exams with every patient. It takes literally a minute. And so keep checking, keep looking, and have an awesome day.